Good afternoon, everyone. Welcome to this webinar presented by the American Academy of Pediatrics and HealthyChildren.org. We have many parents, grandparents, educators, and others who care for kids in this webinar with us today. With so much information out there about childhood immunizations, we're glad you made your way here. Now let me introduce our host, Dr. Jennifer Hsu. She's a practicing pediatrician, author, and mom in Atlanta. Dr. Hsu is a frequent guest on national and local TV, radio, and web-based programs, and she's co-author of the AAP books, Heading Home with Your Newborn and Food Fights. She is also the medical editor of HealthyChildren.org, the official parenting website of the AAP. Welcome, Dr. Hsu.
Thank you so much for having us today. As kids are growing through predictable stages, timing matters a lot. They go from walking and talking to making friends, and at the same time, their immune systems are growing too, and the timing of immunizations matters. But when is the best time and why? And what can you expect after vaccination? Joining us to answer these and other questions today is Dr. Adam Ratner. Dr. Ratner is a pediatric infectious diseases physician, researcher, and educator based in New York City. He's a member of the Committee on Infectious Diseases of the American Academy of Pediatrics and an associate editor of the AAP Red Book. He speaks widely in both academic settings and news outlets on topics relevant to vaccination and infections in childhood, and is the author of the book Booster Shots, The Urgent Lessons of Measles and the Uncertain Future of Children's Health. Welcome, Dr. Ratner.
Thanks so much. I'm delighted to be here.
Awesome. But before we dive in, we are going to start with a quick poll. So attendees will see this on your screen, and we hope everyone will participate. This will help us understand what questions you have as we get started, and we'll try to answer as many of these as possible during the presentation as well as afterwards in the Q&A session. So we'll give people a minute to respond. This is multiple choice. So let us know which part of immunization might feel most confusing to you, when they're due, what each vaccine does, what to expect at the visit, and vaccine side effects. So thank you for participating. As now that we have the answers, we'll show that these are things that we talk with our patients every day in the office. It looks like there's a pretty even amount when they're due, what each vaccine does, side effects, and then a little bit on what to expect at each visit. It's interesting. It looks like maybe some people voted more than once because I'm seeing more than 100%. So thank you for participating, and we will go ahead and keep those in mind as we move on to the first slide, which is, when is the best time in a child's life for immunizations? Dr. Ratner.
Right. So I would think of vaccination as a way to give a baby's immune system a head start against some infections that kids are particularly vulnerable to early in life. And then as kids get older, their immune systems develop along with them. And that's partially due to vaccination and partially due to just their experience and being exposed to things. Their immune systems learn from vaccines how to recognize and respond to different viruses and bacteria that can make them sick. And the routine immunizations that we're talking about today and that the AAP recommends on their schedule are important to keep individual kids healthy. And they also have another benefit, which is that they help keep our community healthy, to protect kids and adults around the child who's getting vaccinated, who may also be vulnerable to those diseases.
Excellent. So that makes sense when you see like the AAP's periodicity schedule. That's how often we recommend that children be seen by their pediatrician. You'll see a lot more visits early in life when they need a little bit more protection. They're most vulnerable, and then they spread out to yearly. Once a child hits age 3, we'll start seeing them once a year instead of every month or 2 or 3. Our next slide, what about the timing and pacing of vaccines? So how is it decided what ages are given and how many and how frequently a child needs, because some vaccines you just need maybe one of, or you get one a year, like the flu vaccine, or some certain vaccines you need three or four of over a child's life. So how's that decided?
Yeah, this is a really common question, especially now. I think that a lot of parents are interested in why we give vaccines with the timing and the pace that we do, and what the thought process is behind that. And what I'll say is that the American Academy of Pediatrics vaccine schedule is really carefully thought out. We have been making vaccine recommendations from the AAP, since the 1930s, and each time it is a deliberative and very intentional decision what goes onto the schedule and why something is being given at the time that it is. Our annual schedule for 2026 came out just earlier this week, and you can find it on the AAP website. And it's designed around a few things. So number one, and I think most importantly, when are children most vulnerable to the diseases that we can protect them against? And part of that also is, when can we give vaccines at a time when children will respond to them? When are their immune systems ready to respond to the vaccines? And of course, underlying all of this is when we have information and data to know when those vaccines can safely be given to children. And safety is the primary thing that we think about when we're thinking about where to put vaccines on the schedule. No one can predict exactly who is going to get seriously ill from a disease. And we worry that if people go with alternate vaccine schedules or decide to skip vaccinations for their kids, that we'll end up having more kids in the US getting sick. We try very hard to design the schedule that gives the kids protection at the time that they need it, at the time that they're vulnerable to these diseases. And that's why I think AAP and all of us as pediatricians think that it's really important for a well thought out schedule to be out there to give families some guidance and to give pediatricians some guidance and a starting point for talking about vaccines with families.
That's really impressive that the yearly recommendations have been out since, you said, the 1930s. I've been in practice for about 30 years now, and there are, slight changes that come out every year. And I find that really reassuring, because it shows that the AAP is looking for changes in science and changes you know, in kids' immunity and what diseases are out there. So even in my, time in practice, I've seen some vaccines become recommended less because there's less of the disease, around. And things. I love that the AAP does make adjustments, when kids don't necessarily need as many, because that can be as a concern. But always based on science, not just based on, it seems like that's a lot of shots for a young baby. Let's make some changes. So that brings us to our next slide, which is that parents may have heard that there have been some changes to the federal government's recommendations on vaccines, and that's reports coming out from CDC, which is part of the Department of Health and Human Services. Can you just walk us through a few of those and give information about why the AAP disagrees with some of these changes?
Yeah, I'd be happy to. I think that I'll start by saying that a lot of the changes that have been made recently by CDC and HHS have been really unfortunate. And it's very much a departure from how those bodies have in the past made decisions about vaccines. In general, what happened was they took some vaccines that had been routinely recommended, and without any new science, they turned those into vaccines that are not routinely recommended. And the AAP and pediatricians and doctors in general feel very strongly that we should be equipping kids' immune systems with the ability to resist certain diseases that make them sick. So I'll take as an example the hepatitis B vaccine, which is something that's been in the news a lot recently and was on the list of changes that the government made. We have, since 1991 in the United States, given a birth dose of hepatitis B vaccine to all children in the United States. It is recommended for all children. It's not mandatory. People can opt out of it, but that has been a consistent recommendation from CDC, HHS, and from the American Academy of Pediatrics. And the reason for that strong recommendation is that it helped us go from a point where some children would get hepatitis B around the time of birth and develop chronic liver disease, and some even to die from that infection, to a point where we've reduced the rate of hepatitis B in the United States by more than 99% as a result of that policy. And what I worry about, and what the AAP and pediatricians worry about, is that taking that recommendation from a routine one to one that's not routine will end up putting kids at risk unnecessarily, and it's going to risk losing the progress that we've made in our community. We see that with some of the other recommendations also. So two things that are close to my heart are the recommendations about RSV, which is respiratory syncytial virus, and rotavirus. And I care a lot about these because both of them are major causes of hospitalization in young infants. And I am old enough to have done my pediatric training at a time before we had immunizations for RSV and rotavirus. And I will tell you, the hospital floors, the pediatrics floors in our children's hospitals looked very different back when I did my training. All winter, you had children being admitted with RSV and with rotavirus, which is a cause of terrible diarrhea and dehydration. And those are both, rotavirus vaccine has been around for a while, and so the rates of hospitalization from that are way down. And even just in the couple of years that we've been able to immunize kids against RSV, we've seen a big decrease in the number of hospital admissions from this. So these are big success stories. And I think we're worried that the confusion for families, even just based on moving these from a routine recommendation to a shared clinical decision-making recommendation, it will be enough to make some families decide to skip those vaccines, and that will put their kids at risk. And that's not what those parents want. They don't want to put their kids at risk. And so the other thing is pediatricians have been talking about risks and benefits all along. This is not a new thing. So I mean, I think if I can say one thing to the audience, what I would say is that, reach out to your pediatrician if you have questions about vaccines. And as you brought up a minute ago, AAP has always made changes to the vaccine schedule when they're warranted. It's not that we are against changing the schedule, but you change the schedule when you have new information. So I remember when we went from giving the oral polio vaccine, which I'm sure some people on the webinar today got when they were kids, that's the one that I got when I was a kid, to the inactivated polio vaccine, which is what we give now. And that was because things changed. The epidemiology of polio changed. There was no polio in the United States. It was still possible to import it. And so we had to protect kids, but we got to move to a different kind of vaccine because things had changed. And that was based on careful review. And so I think that that is built into the process. And when you subvert the process of how these vaccines get recommended, I think you end up with confusion and possibly with danger for kids that doesn't need to be there.
You mentioned confusion. I think for people who live like near a state border, it can be confusing because one state may require certain vaccines for school and another state may not. So there definitely can be some confusion there. Another thing for the audience to keep in mind is that there are 12 major national professional health organizations that all are sticking to the routine vaccines and not the changes that the CDC is recommending. And those organizations represent over 1 million healthcare professionals in the United States. So there is a lot of support for keeping the scientifically proven schedules the way that the AAP is recommending every year. So we're not alone as an organization in recommending what's scientifically sound. So let's move on to the next slide, which is what can you tell us about the timing of vaccine for the youngest babies? So when some when parents are in the hospital, they're all of a sudden bombarded with all these things that the babies get. Here's your vitamin K injection, here's your erythromycin eye ointment for your baby, and then your hepatitis B vaccine, which is recommended in the first 24 hours of birth. So it can be very overwhelming. And even, by 2 months of age, we do give some vaccines, which some parents feel like, the injections might be a lot because it can be briefly painful to babies. So why is it important for these young babies to get vaccines?
Yeah, I get this question a lot, as you might imagine. I'm sure that you do also. It's something that's concerning for families because I think that for all of us, when my daughter was born, I wanted to protect her against absolutely everything, and there's this instinct to not, to shield your child from anything that you can shield them from. And I think the thing that I will emphasize here is that part of giving kids the best protection that we can, part of helping their immune systems become ready to fight off important diseases, is giving them vaccines, including the vaccines that come very early in life. And so the reason that we give vaccines at any particular time is that you want to vaccinate kids when they're vulnerable to a particular disease before they get it, and at a time when we know that the vaccines are safe and that they work. And so, I talked about RSV earlier and how that attacks very young infants. We give the RSV immunization in early life because that's the time at which kids are most vulnerable to RSV and can be hospitalized from RSV. We give the hepatitis B immunization very early in life because hepatitis B can be transmitted around the time of birth, either at the time of birth or from other people in the household or the community. And so it's a time when children are particularly vulnerable to that infection, and when getting that infection can have lifelong consequences. And so these are the kinds of things that we weigh when putting together the schedule.
And the thing about hepatitis B vaccine that I think is hard for parents is that oftentimes when a kid gets infected as a baby, you're not going to see those symptoms. But
Yeah.
later on, they might develop liver cancer, liver failure, which could have been prevented had they gotten the hepatitis B vaccine series early. One interesting thing about the RSV antibody shot is we've been giving that for the past 2, 3 years now, and I'm no longer seeing young babies getting hospitalized for that. I'm starting to see 3-year-olds who did not have access to that shot when they were infants, and they are getting sick, more severely. So I think as more children get the RSV shot early in life, hopefully we're going to stop seeing those early hospitalizations. And when they do get RSV as an older child, it just comes across as a common cold because their lungs are bigger and their immune systems are stronger. So those are some things just to keep in mind. But talking about older children, why do we sometimes give kids vaccines before they go to kindergarten, for example, or before they go to middle school?
Sure. So the thoughts behind this are the same. Like we're timing vaccines, taking into account how kids are developing over time, what their immune system is ready to handle, and what they need protection against at that time. So as you have kids who are getting up to the kind of 4 to 6 year old age range, they're getting ready to go to kindergarten. They get boosters of some of the vaccines that they got in the past. So they get a second dose of the measles, mumps, rubella vaccine. And that second dose is really important because it provides extra protection to give kids strong and lasting immunity. There's the diphtheria, tetanus, and acellular pertussis booster, which is important also. It boosts the immunity before going into kindergarten, into a school setting where there can be transmission. And as kids get older, they need protection against different things. So, in the slightly older kids will get the hepatitis, the HPV vaccine, the human papillomavirus vaccine, and then some vaccines, as you mentioned earlier, are given annually because, like, for example, the flu vaccine, because the flu strain changes a little bit each year, we need to vaccinate each year against the flu. And every year, tragically, we see children who, need to be hospitalized, some children who end up dying of influenza, and the vast, vast majority of those kids with severe influenza have not been vaccinated, aren't up to date with their flu vaccine. And it is, last year was a record year for severe flu cases. We had more than 280 pediatric deaths in the United States from influenza last year. And those are, for the most part, preventable.
Right. One of the statistics I've heard is that of the kids who end up in the emergency department or get hospitalized or die from flu, about 80% of them were not immunized against influenza. So something to keep in mind. And we do recommend that everybody over the age of 6 months get flu vaccine prior to Halloween every year. That's kind of the deadline that I give kids because they can imagine that date in their brains. Oh, let's get our flu shot or our flu spray before we get dressed up for Halloween. What about some side effects from vaccinations? My kids were lucky and never did get side effects, but a lot of the parents that I see in the office worry that the kid's going to have their baby's going to have a fever when if they get sent to childcare after a vaccine visit. So, can you tell us a little bit about the side effects? How common are they and why do they happen?
Sure. So anytime we give immunization, there is the potential for side effects. The good thing about all of the AAP's recommended immunizations is that the side effect profile is very mild. In general, the things that we see most, and these certainly are not in all kids, but we see these in some kids, are swelling or redness or pain at the site of the injection, and that I think comes as a surprise to nobody. That tends to be annoying for a day or two, and then is better. Some kids get low-grade fevers, again, for a day or two. It's not every kid. I think it's not even most kids who get that, but that can happen after some vaccines. And then there are other vaccines where the side effects can be a little bit different. So, for example, the measles, mumps, rubella vaccination, and the chickenpox vaccination as well. There can be a delayed fever or a rash that can happen anywhere from 1 to a couple of weeks after the injection. So I remember that about 10 days after my niece got her MMR vaccine, my sister texted me a picture of my niece and with who had a rash in the picture, and my sister was like, did she get exposed to measles after she got the MMR? Where would she have gotten measles? And I looked at the picture and I said, no, she's one of the unlucky 5%, because about 5% of kids who get MMR get a little bit of a rash afterwards, and then it goes away. It's not dangerous. And the timing was right. She seemed fine. And I do get that it can be concerning, but I think those are the kinds of side effects that we are mainly talking about. The more severe side effects that people read about are extremely rare. So there can be allergic reactions to vaccines. The vast, vast majority of children do not have these. That usually starts pretty soon after the shot, anywhere from 20 minutes to a couple of hours. And that's obviously if there's, severe rash all over, if there's swelling, a kid who's very upset, like that's something where you should seek medical care. And it's important for all of these side effects that parents ask their questions of the pediatrician, either before or after vaccination. The person to talk to is your pediatrician. They know your family best, and they can help guide you through this.
And hopefully, your pediatrician will counsel you at the
Mhm.
time of giving the vaccines. At the 1 year and 4 to 6 year visits, I always tell my patients that if they're getting the MMR and or chickenpox vaccines, there is a chance of that delayed rash that you've talked about. But honestly, in the past 15 years, of my practice, I've only seen about 5 kids with that delayed reaction rash, but I want to make parents aware in case that their child is my number 6. So it's not a surprise if it does happen, but like I said, it's not that common. We have gotten some amazing questions, and let's see. One of them is for the children who do get that rash from the MMR. How long does that typically last? And in my experience, it's just for a few days. What about you, Dr. Ratner? How
Yeah.
long would you think?
Couple days,
Yeah,
not dangerous. Most of the time, not associated with fever or anything else that goes with it. It's it can be concerning when it pops up, but it is not something to worry about.
excellent. We've gotten a lot of questions about the RSV shot. One question is it better for the mother to get it during pregnancy or for the baby to get it once the baby's born? And can you talk a little bit about who can get it during pregnancy? Like, do you get it during every pregnancy like you would with maybe tetanus, Tdap, and flu? What's that indicated for in pregnant moms as well as for babies?
Yeah, so the answer for the first question about whether it's better to do maternal immunization or to do the antibody shot at the time of birth, it's really important to do one or the other of those things. And whether the difference between them, I think, is much less meaningful. We, in general, only give the immunization after birth to kids whose moms didn't get the vaccine during pregnancy. In some circumstances, we would give it. Like, for example, if someone got the RSV vaccine during pregnancy, but then had an early delivery that happened, in the week after that. If it hasn't been at least 2 weeks, there's not enough time for the antibodies to make it across the placenta to the fetus. And so that would be a kid who didn't get the protection from the maternal vaccine, and so we would recommend that child get the immunization. So it's that in general is how we counsel people, which is that either of these strategies is fine, but it's important to do one or the other. And then in terms of the every pregnancy question, I don't think we know the answer to this yet. The recommendation, as I understand it, and I'm not an obstetrician, but the recommendation now is that you don't give it in subsequent pregnancies, but that you don't consider in the subsequent pregnancies that the child is protected. So if you have baby number one and you get the maternal vaccine during pregnancy, in pregnancy number two, you don't get the maternal vaccine, and then we give one of the antibody preparations after birth. I think that we will learn more about that as time goes on, and it may be that there will be repeat doses in other pregnancies, or perhaps that won't be needed.
One other question is, what if your child, so let's say there's a 2.5-year-old and did not have access to the RSV shot at birth? Is there any chance or recommendation for them to get the shot now?
There's not a routine catch up recommendation, in part because the kids who we worry most about RSV in are those much younger kids. Not that RSV is not a thing in older kids, it's just that it's much less likely to cause severe disease and to require hospitalization.
Okay, good to know. And can you tell us a little bit about the seasons when the RSV vaccine is given to women during pregnancy or to babies once they're born?
Yeah, it varies a little bit state by state, and that it's basically what you want is to be doing maternal immunization a little bit before the RSV season, and that gets stopped toward the end of RSV season, and then we give the antibody that's given at the time of birth during RSV season. And the reason for that is that there's a delay between when the maternal vaccine is given and when the child is born. So this is another example of the recommendations really being tailored to the individual child and the timing of the year. Because if you have a child who is born in the summer when RSV isn't circulating, that's not a kid who needs the antibody right at the time of birth. That's a kid who needs the antibody at the start of their first RSV season. So it would be in the fall.
Okay, makes sense. Lots of questions there. Definitely talk
Sure.
to your pediatrician because they are
Yep.
going to stay up to date on that. Let's pivot a little bit to, are kids ever contagious after receiving a vaccine? And do they have to have a fever to be contagious? So can you
So
ever? Yeah.
So things differ vaccine to vaccine, but in general, vaccines are not transmitted from one person to another. I've gotten this question a whole bunch of times. Most of the vaccines on the schedule are not live vaccines, and so there would be no way for them to transmit. And then even the ones that are live vaccines, so measles, mumps, rubella, the chickenpox vaccine, the rotavirus vaccine, there are a handful of them. For the most part, do not transmit to other people. And the only time that we're super careful about that is if there's someone in the home who is very, very immune compromised. But even for in that setting, if you're talking about like the MMR vaccine, I don't know that there has ever been a confirmed case of someone transmitting that vaccine.
The infection
Yeah.
from the vaccine, right? Yes. Okay, excellent. Um, we've gotten a lot of questions about the hepatitis B shot given at birth. So, one of the
Sure.
CDC recommendations is to screen the moms during pregnancy. So, if a mom is negative, why do you still need to give the vaccine to the baby at birth?
Yeah, great question. So that screening is not new. That has always been part of our strategy to prevent hepatitis B because in the setting of a mom who we know has hepatitis B, you actually do two things. You give the routine hepatitis B vaccine and you give something else called HBIG that gives immediate protection. That's an antibody thing like the RSV shot, and that decreases the risk even further. So there's always been routine screening in pregnancy. The reason that you can't rely on that for the decision to whether or not to vaccinate a child against hepatitis B, there are two reasons. Number one, lots of people don't get screened. Number two, the screening results are not 100% accurate. They're really good. It's a good test, but it's not 100%. And the consequences of missing someone, if you get a test that says negative, but that person actually has hepatitis B and you don't give the early life vaccine, that's a kid who potentially is in danger. And so both of those things are important.
So, and then the mother is tested early in pregnancy. So she could convert
Yep.
and be actually positive closer to the delivery.
Yeah, and
You
then the
mentioned,
the other thing that's important is that the mother is not the only potential source of hepatitis B for newborns. She's the only one who's a source right at the time of birth. But kids then go home, they're exposed to other people in the family, they're exposed to visitors and other folks. And the thing about hepatitis B is, as you pointed out earlier, people can be infected with hepatitis B and not know about it for many, many years. And so if you have the dad in the family who has it, or someone else in the family, or a caretaker or something like that, it is safer. The safer choice is to provide that first protection and that first education of the immune system very early.
and that's important because you talk about other family members or visitors to the home. It's not only transmitted by blood, but it could be from other body fluids such as saliva. So
Sure.
possibly a child who gets bitten at a child care center could get it from somebody who's infected and you don't know that they're infected. And recently we had some 2 or 3 year old children at a child care center who happened to pick up a syringe that was at the playground. And so, they had to be tested for things like hepatitis B, C, HIV, but they had been vaccinated against hepatitis B. So there was a little
Yeah.
peace of mind to that. So there are ways to get it not just from an infected mother. Okay. Let's talk a little bit about this is a good question. So, if a mother got the Tdap vaccine during pregnancy, first of all, is that recommended every pregnancy
Yep.
as
That
opposed to
one that
RSV?
one
Yes.
is. So
Okay.
that's different. That's one where we have data that tells us that, A, it's safe to give in every pregnancy, and B, the antibody levels in the mom wane quickly enough. They go down quickly enough that it's important to do it in each pregnancy. And the main thing that you're trying to do there is to have an immune response in the mom, antibodies transferred to the fetus that are then there in the newborn, and they provide protection against diphtheria, tetanus, and pertussis early in life. And the children who we see who get really sick or die from pertussis tend to be in those first couple of months of life. So we're really trying to give protection when it's needed.
So that's why the baby still has to get the DTaP, injection or as part of Pentacell or Vaxelis or something
Yeah,
like that.
because even if the mom has gotten DTaP, those antibodies hang around in the baby for a little while, but not for that long. And so it's important to start the regular series because what you want is long-lasting protection in the child.
Okay, these are so many great questions coming in fast and furiously. Let's talk about the MMR vaccine. Right now, it's recommended at 12 months of age, and
Mhm.
then again with a booster later to catch the kids who maybe did not get the immunity the first time around. What about babies who are traveling before the age of 12 months? Is there an age where you might give that vaccine early?
Sure. So this comes up a lot, especially now because there's so much measles in the US. Like it used to be, we talked about this pretty much only in the context of international travel, but now you don't even really need that. Um, so the MMR vaccine is safe to give down to about 6 months. We give it at 12 months because we know that it works well then and it provides long-lasting immunity when you start it then. In the setting of an outbreak, so if you have an 8-month-old and you live in an area that is having a big measles outbreak, the local health departments make recommendations, and one of those recommendations they may make is to give kids the early dose of MMR. So that would be a dose sometime between 6 and 12 months. That is, we call it MMR 0 because it's the first dose, but it doesn't count as one of the two doses later. The child still needs a dose on their first birthday or later, and then another dose after that to have full protection. But we do, in the setting of outbreaks or in the setting of someone who's traveling to somewhere where there's measles circulating, we do sometimes recommend that early dose.
Right. So, in Texas, when there was an outbreak, a lot of patients said, I live near this area. Should we get the vaccine early? Yes. And then where I live in Georgia, we're right next to South Carolina where there's an
Yeah.
outbreak. And so many of my patients are getting it after 6 months now.
Yeah.
Let's talk about herd immunity. So,
Sure.
community immunity, herd immunity, that cocoon effect. What can you tell us about when you have a certain percentage of individuals in a community vaccinated versus not, or immune versus not?
Yeah, there's nothing I love like I love herd immunity. So it's wonderful because vaccines are something that we do for selfish reasons sometimes, meaning that we want to protect our own kids against things that can make them sick. But also, it's part of being a community member because there will. If you think about something like measles, which is the most contagious disease that we know of, and it can circulate in communities, and you can never have a population that is 100% vaccinated against measles because there will always be kids under 6 months of age and they can't get even the early vaccine. There will always be people who have immune deficiencies, people who are getting chemotherapy for cancer, for other things that may make them either not eligible to get the MMR vaccine or may mean that they don't respond to it. And so we will always have people in our community who are susceptible to measles. So there are two things we can do for them. Number one, we can protect ourselves and surround those people with a highly vaccinated population. And what that means is that if a measles case comes into the community, it can't take off. It can't because measles needs to spread from person to person. It's not something that, sits on surfaces or that you get from the soil or anything like that. Like it needs a chain of transmission. And so we can interrupt that transmission, but you need a really high vaccination rate, meaning like 95% or higher. But once you get there, which is what we had in the US for many, many years, you can interrupt transmission and you can provide protection even to the folks who didn't get vaccinated or who can't get vaccinated.
Okay, let's shift again to there are some questions about access to vaccines. So, if CDC, HHS are not recommending certain vaccines as being important to be enough to be routine, Are pediatricians' offices still going to give it? Does a parent have to specifically ask for these vaccines? And will insurance continue to cover these vaccines?
Yeah, these are great questions, and they're questions that I'm getting a lot, and that I'm sure that you're getting a lot also. And I think no one has the answers to all of these questions. What I'll say is, it's one of the reasons that it's so important that we have recommendations from AAP, because many states, I live in New York, and so my state included, have said, okay, we're going with the AAP schedule, and they have made it so that insurance has to cover the vaccines, that pediatricians know in the state know that that's what's recommended by the state health department. And there have not been problems with access. My understanding as of now is that all of the vaccines on the AAP schedule are available, and that they still have to be covered by insurance. I don't know what the future will bring for the second half of that. I hope that that continues. And all I can say is I would stay in touch with your pediatrician about this, and they will be able to tell you if there are access issues of any kind. But right now, I know AAP and a lot of us are working very hard to make sure that parents have access to vaccines.
And the important thing you mentioned is keep in touch with your pediatrician, because they know
Yeah.
your family the best. They know your child's medical history the best. We went pretty quickly through a lot of these questions. And so if you missed anything, definitely ask your pediatrician to clarify for you. This recording will also be on YouTube so that you can go back and listen as well. So I'm sorry we weren't able to get to all the questions because they were a ton. But before we get to the wrapping up poll and closing down, I wanted to see if Dr. Ratner had any final comments that we haven't covered so far.
I think we've hit the really important parts. I'm really grateful to have the opportunity to talk to you about these important issues. I'm grateful to the people in the audience who have shown up to listen to us talk and to ask wonderful questions. I want to emphasize that there's a lot of confusion right now, including among doctors, because there have been the schedule changes, there have been conflicting announcements, and some of that confusion may be deliberate. And I once again urge parents to partner with their pediatricians. They're the people with the training, the experience, the knowledge of your family, who can really help make sure that you have the information that you need.
And I'm so impressed by the level of questions that these
Yeah.
attendees have asked. I mean, these are really high level thinking questions. And I'm really proud of parents who are really wanting the best thing for their kids. And as a pediatrician, I would not recommend anything for your child that I wouldn't do for my own child.
Yep.
So thank you for everyone's really thoughtful questions. So we will go on to our closing poll question next. So that'll show up on your screen. So if you could just please answer this, and just to kind of get an idea of what you might have taken away from this talk today. So the question is, true or false, the timing of immunizations is designed around when kids are most at risk. True or false? And please submit your answer. Would love to see your responses. And I think we did cover this fairly well today. And wow, 94%
Yay.
say true, 6% say false. Great job, attendees. Thank you for listening there and paying attention. And the answer is true. Excellent. So we will now turn things over to AAP staff to wrap this up.
Thank you so much, Dr. Shu and Dr. Ratner. Great discussion. We'd like to remind participants to register on healthychildren.org for our e-newsletter, personalized homepage, and special offers. And don't forget to follow Healthy Children on Instagram, Facebook, TikTok, Threads, and Pinterest. Also, subscribe to our Healthy Children podcast. You can listen to it wherever you get your podcasts, or go to healthychildren.org/podcast.